Total hip replacement is one of the most successful operations that we have in medicine. The overwhelming likelihood is that your pain will go, you'll enjoy a really good level of function, and that will last for a very long time. There are, however, some risks to the surgery. It is major surgery and nobody should underestimate that. I just want to spend a few moments talking you through some of the risks of hip replacement and what the consequences of those might be. It's really important that you talk to your surgeon about the risks, how he or she minimises those risks, and what the outcome might be if any of them happen, God forbid. The chances are, however, that you'll be fine, this won't happen, but you just need to know what you're taking on. The first risk I want to talk about is infection. Infection can vary between a minor wound infection all the way down to a deep infection that involves the hip replacement. The deep infection rate at Swellock is somewhere in the region of about 0.5%, which is as low as anywhere in the country. If it happens, however, it is a devastating complication for a hip replacement. If bacteria get into the joint and stick to the metal, then we have to remove the metalwork to cure the infection. This means at least one more very big operation. The worst case scenario is you could be left without a hip joint at all, but this is extremely unusual and very rare. The ways that we try and prevent infection are to give you antibiotics at the time of surgery, perform a careful operation with minimal soft tissue damage, care for the wound in the best way possible, and discharge you from hospital as soon as possible because you're safer at home in this respect. The chances are infection will not happen, but if it does, you'll be treated very seriously and you may be referred to a specialist unit who has a lot of experience treating that sort of problem. The next thing I want to talk about is dislocation. This means the ball and the socket coming apart. It's extremely painful, you will not be able to walk on a dislocated hip, and you will need to go to hospital and have the hip relocated, put back into joint. The risk of this for the patients at Swellock is less than 1%, but it can happen. It may happen innocently, perhaps if you're reaching, bending or twisting, or it could happen if you fall over. The risks of dislocation occur for the whole time that you have your hip replacement in your body, but the risks are higher in the very early post-operative time. The way that we try and minimise the risks, of course, is to do a very careful operation, and you will be educated about what's sensible and what is not sensible in terms of your activity for the first few weeks after the operation. If a dislocation did occur, the leg would be shorter, it would be turned either inwards or outwards, and you would not be able to walk. You'll need to call an ambulance and be taken to your local accident and emergency department, where the hip will be relocated as an emergency, after which your surgeon will take you back on and manage the problem from there on. Getting the leg lengths the same after hip replacement is challenging. Patients do not tolerate leg length discrepancy well, and if there is a significant difference in your leg lengths, you won't like it. It's really difficult, however, to get the lengths exactly the same. After your hip replacement, there may be a difference in length of 1 millimetre or 2, and actually up to 0.5 centimetre you probably wouldn't notice. Very rarely there may be a leg length difference after surgery of more than 0.5 centimetre or so, and occasionally, very, very rarely, an operation is needed to readjust the leg lengths. What I must say to you is that when you get out of bed straight after your operation, it's extremely common to feel that the operated leg is too long. This is because of the swelling of surgery, imbalance in the muscles after surgery, and this is something that you'll get used to very quickly, and the nurses and your therapist will help you to understand that whilst the legs feel a very different length, actually they are exactly the same, and you'll be fine in the long term. When we perform a hip replacement, we're operating very close to some of the major nerves in the leg. If these are injured at the time of surgery, it can cause temporary or permanent problems in the leg lower down than the hip. The sciatic nerve is at the back of the hip and always very close to the surgeon when operating for hip replacement. If the sciatic nerve is damaged, it can cause numbness and pain in the foot and a foot drop, which means that as you walk, your foot does not come up and it can be difficult to clear the ground with the foot. The pain, the numbness and the difficulty walking that go with a sciatic nerve injury can be extremely troublesome, and we go to enormous precautions during surgery to make sure this does not happen. The quoted risk of a sciatic nerve injury at the time of hip replacement is approximately 1 in 500, but we would estimate at Swellock that it's less than this. The other major nerve that can be injured during hip replacement, although less frequently, is the femoral nerve. This is the nerve that enables you to extend your knee actively and is really important for walking. Damage to the femoral nerve is very unlikely, but if it did happen and if it became to be permanent, then there would be weakness in your thigh and it would cause significant difficulty with walking. One other nerve that needs to be mentioned is if your surgeon plans to replace your hip through the anterior approach, there is a risk of damage to a nerve which supplies sensation to the outer aspect of your thigh. This is something you should ask your surgeon if you are having a hip replacement through an anterior approach. Whilst we're performing the hip replacement, there is a risk of damage to the bones and blood vessels around the hip. This can lead to fracture of the bones and a need for blood transfusion after surgery. If there is damage to the bones during the operation, this can almost always be sorted out during the operation, and it's not something that you would generally know about. Blood transfusion after hip replacement at Swelliot these days is extremely rare, but if it is needed, it will be to ensure your well-being, and it's not something that you should worry about unduly. There are two types of blood clot that we worry about. One is a deep vein thrombosis, and one is a pulmonary embolism. A deep vein thrombosis is a blood clot in the lower leg, in the veins of the leg. This can cause swelling, pain, and redness in the skin, and generally will go away either of its own accord or with some relatively simple treatment. More worrying, however, is if the blood clot in the leg breaks off and travels to the lungs, this can cause a pulmonary embolism. This is extremely dangerous. It can cause collapse of your circulation, cardiac arrest, and even death. It's really important that you familiarise yourself with the signs and symptoms of blood clots, and we will give you education about this at the time of your stay in Swelliot. Basically, we'll give you a spinal anaesthetic, compression on the legs, encouragement to mobilise early, and some form of medication that will thin your blood a little after your operation, and all of these are to minimise the risks of blood clots. Nevertheless, even with the best intentions, these can happen. And at the end of the day, you can do just about anything with your hip that you want to, and just accept that the more you do with your hip, the less it might last. But even with being very active, out and about, enjoying sports, golf, all recreational activities, we would expect that your hip replacement will last you for hopefully 20 years or more. And most patients these days, one hip replacement is lasting for their lifetime.